Wonderful.
So you should just cancel the class.
Thought I'd get started today by showing you this article that was published about 10 years ago, actually. But the situation hasn't really changed. I think this was 10 years ago. No, 2011, so 6 years ago, 7 years ago. The purpose was, they actually did a study looking at different strategies and conducted a kind of an experiment. But here's what they found, and this is something I thought was really interesting. I think they'll highlight this. Basically, patients don't know what pharmacists can do beyond dispensing. Patients don't think they need clinical services, and patients are unwilling to pay for clinical services. Does that sound right? Does that sound consistent with what you know to be the state of the world out there? Yeah? So my question for you is, how can we change that? Well, that's the exact answer I get from pharmacists when I ask them that question. And the problem is, same thing I told you last time, if I ask you that question about why somebody should shop at your store rather than somewhere else, if you can't answer that question, then we need to just give you a quarter, tell you to call your mom to come and get you, and you need to look into real estate or something like that. Because bottom line, if we don't know why pharmacists, or if we don't know the answers to these questions, how do we expect our patients to? So that's kind of the challenge of marketing, is how do we get the word out about the things that we do, what we're capable of, why it's good for you, and why you should be willing to pay for it. Which I think all of those are true when you really understand the pharmacy care process. Every single one of you in this room who's worked in a pharmacy as a tech or an intern or assistant pharmacist in any capacity has seen the benefit, the potential good that can come from good pharmacy care. So, they say to overcome these challenges, pharmacies should consider integrating marketing techniques, such as tailoring marketing to a target population, forming and utilizing relationships with patients, and looking at past marketing successes to develop marketing plans. So, I guess the comment that I make about that is yes, or duh would be another possible comment. So we've got to get out there, get things said, we've got to get things done so that people know what we're doing. Now, along with this, let me show you another pub that came out here. This was a review of all the different work that's been done in community pharmacy. This one was the one that was done in, well, this one was just last year. Anyway, what they did was they looked at all the research that's been done in community pharmacy marketing. You think there's been a lot? Depends on how you categorize a lot. But what they did say is that there is limited and little evidence is available to show the effects of the activities that people use. And we all believe literature, right? Let me just show you it's going to come up eventually. Must not have loaded properly. Well, bottom line, there are about 30 or 40 different studies that were done since about 1979, and all of them were reviewing specific things like pharmacy patronage motives. Why do people go to the pharmacy they go to? And the answers that they found is convenience, friendly pharmacist, price. But there just isn't a lot of work overall in marketing, and that's kind of why we still talk about it here in pharmacy school. Oh, I wanted to, after doing that short little intro, I wanted to give you some examples of the questions so you might have a better idea of what to expect. All right, so here's a question. Which of the following, and I'm going to revise these, which of the following statements about the overarching goal of a marketing plan is most consistent with class discussion? Some of the choices include: a marketing plan is only necessary when you're developing new products or services. Would that be true or false? False. A marketing plan modulates measurable, well, we haven't got to that yet. Marketing plans must focus on the 4 P's of product marketing. That one should throw you off a little bit. Because, well, last time we talked about the 4 Ps, we also talked about the 4 Is. So everybody's thinking, well, what about the 4 Is? We should include those too, right? A marketing plan is a way to create an image in your customers' minds that makes your business memorable, gets you thought of first and favorably. Yeah, okay. Here's a good example of some problems. According to our class discussion, there are some that believe you should refrain from using marketing and healthcare in the same sentence. In other words, not everyone is willing to accept marketing when it comes to healthcare, and this can be an obstacle for pharmacists. True or false? Okay.
What are the answers?
The core concepts in marketing are needs, demand, and value.
What?
It's just incomplete, so it'd be false. What are the others? The most important one, the last one, the one about making people happy, so satisfaction. So needs, wants, demand, value, and satisfaction. Those are the 5. Top of mind awareness question. Oh, here's a good one. Which of the following statements best reflects the instructor's view of marketing's ultimate goal? Top of mind awareness is not as important as target marketing. True or false? We haven't talked about target marketing, so I wouldn't expect you to. Accounting is more important than marketing.
Oh my God.
Dr. Hurst is a better lecturer than Dr. Perry, the same thing. So what would I think about that? Marketing should be done solely by pharmacy owners.
No.
And lastly, if you see them all together, you'll realize what the answer is. Focus on selling wholes, not drills.
Selling what?
Y'all agree with that? Okay. All right.
Not through. Can we really make you with the people?
Product versus marketing orientation.
Dr.
True or
Perry,
false?
if y'all are having a discussion about it, we can't hear the answers.
No, there's no. Why do you think anybody's answering me? No, there's no discussion other than what I'm saying. Thank you for letting me know, though. I'll be making. Do you all have buttons to push? So from now on, when you're talking, push your button. So nobody's finger will be tired, I'm sure. So. The customer should be at the center of all product mix decisions, namely figuring out a way to make them happy and solve their problems. True or false?
I don't know.
True.
Awesome.
All right.
The customer should be at the center.
Some more stuff we're going to cover today.
Did anyone else make that? Yes.
That's about it for marketing. So there's I don't know, there'll probably be about 10 or 15 marketing related questions. All of them are about like that. So if you were here, you were reasonably listening, and you looked at the slide, you should be in pretty good shape.
Thank you.
All right, let's get down to
Tests.
last thing I wanted to do before we actually jump in today was to show you this. It was something that I came across a while back that I thought was kind of interesting. And this was some recommendations from people that don't do marketing just for pharmacies, but they just do it in general. And these were some 10 strategies that you could use as a pharmacist to appeal to your customer base. And some of these I think make a lot of sense, but there's a theme to what they're getting at here. And I wanted to go through these and see if you folks can come up with what the theme might be. Number one is to survey your patients. What do they like and dislike? How do you compare to big box pharmacy, et cetera? Following up with patients. Asking them how things went last time they were in the pharmacy, that kind of thing. Writing an article for a local magazine, opinion piece for your newspaper or something like that. I think that's interesting when you think about it. Not many of you probably think about yourselves as writers, but it could be something you could do that might be able to spread the word about what pharmacists do, why clinical services would be important, and so forth. Establish an online presence. Has this grown in importance in recent years? Is it likely to continue to grow? Might it be perhaps one of the most important things you have? an app for prescription refills, etc. down the road, starting a blog. And there are plenty of people out there my age and older who would say, what's a blog? And people my age and younger say, what's wrong with him? So starting a blog is something that you can think about, and I've seen it successfully used. One thing I've noticed about blogs is they tend to have very loyal followings. So if you're trying to create a customer perception or to gather customers together who are of similar mind and thought and want to read and talk about the same things, a blog is a great thing to do. Free stuff, everybody likes free stuff, right? When you go to GPHA or GSHP convention, if you go to those or you go to APHA or anything like that, what's the most popular part of the whole meeting? The exhibit hall. Why is the exhibit hall the most popular part? Because you get free stuff. This is interesting. This can be expanded dramatically. How many of you have an app on your phone? Used to be a card in your purse or wallet where you got them to punch your card each time you came in and bought a sandwich or something, and then after 10 you get a free one, and now you have the app that does that. These kinds of programs create excitement. They create the kind of spirit that you want when you're talking about bringing people back into a business. Can you do that in pharmacy? 10 prescription free. I mean, that doesn't make a lot of sense, but what could you do? Well, CVS, did you see the lady holding her CVS receipt? I think it was, if you Google lady with long receipt, you'll see a picture of this woman standing in front of the camera holding a 7-foot-long CVS receipt with all kinds of coupons on it. So you can take this, you can take it too far. But people generally like free stuff, generally. Hosting seminars or demonstrations, again, educational. Using good signage within the store and outside of the store, again, educational. Giving out coupons, that's about free stuff again. And then staying abreast of what your competition is doing. And do you think if you've got an independent pharmacy that's doing a lot of marketing in a small town and then there's a Walmart, is that independent pharmacy going to be more or less effective by virtue of the presence of the Walmart? Is there a relationship? Does competition matter? Is what the real question is. So if you've got a big box retailer that has a national advertising presence and you have no advertising, you're at a disadvantage. If you're doing a lot, you might just be breaking even with them because of the virtue of how much advertising these guys do. On the other hand, if you are competing against other independents, it's kind of like whoever brings the biggest army usually wins the battle in medieval times. It's the same way with marketing. Whoever spends the most money, whoever has the best design strategies, the ones that are most appealing, provide the best information, usually wins that battle. Which is why Dr. Perry says, if you're going to do advertising, just hire somebody. But anyway, these are 10 high-impact marketing strategies that work. Do you see a trend? Is there anything that you can identify, sort of a common factor between many of these? Not all of them, but many of them, other than people like free stuff. I think that common trend, that factor is very simple. People want and people need information. We just aren't very used to giving it to them as pharmacists who are doing advertising. Marketing is advertising, it's promotion, it's sales, it's all that stuff. But all that is based on providing information to your customer. Information is designed to get them to buy your product or service, patronize your store, or whatever it is you're trying to accomplish with that advertising. So some stuff to think about. All right. So here's just a graphic that I wanted to kind of give to you to frame what we're going to talk about today. We've got the higher level marketing objectives. This is where we decide whether we have a market or a product orientation. Definitely will ask you to differentiate between the two of those on the test. So market versus product. So product was, I've got the product to sell, I'm going to sell the you know what out of it. And that's what I do. Marketing orientation is, I need to understand my customers. I need to know what it is that makes them happy, what solves their problems, etc. And then meet that need. So that's the marketing orientation. Then we develop marketing strategies, and these are going to be based on two things. Who our customers are, and what we want them to think about us. That's over here on the left-hand side. And then the variables that we get to manipulate. So these are the 4 Ps: price, place, product, and promotion. The people, physical evidence, and process really relate to the 4 Is. There's just some controversy out there about 4 Ps and 7 Ps, 4 Ps, 4 Is. Don't worry about it. Just remember the 4 Ps and the 4 Is and you'll be fine. So today we're going to talk about segmentation and targeting. Talk a little bit about product differentiation, but that's not really as important because pharmacies are fairly the same, right? No matter where you go, you get the same thing, right? Is that true? Anybody at all have an opinion about that? If I go to, I won't say Walmart, because I've recently had a very good experience at a Walmart. How about CVS? If I go to a CVS, get a prescription filled, stop time, roll it back, instead go to Hodgson's Pharmacy, or Village, or Ad. Is my experience likely to be different or not?
Yes, because your daughter works at Hodgson's Pharmacy.
Some of you are shaking your heads yes, you think it will be. And it depends, I think. It depends on which pharmacist is working, how busy they are, all that kind of stuff. But the idea is if you can't differentiate between going to one store or another, you'll just go wherever is most convenient for you at that moment in time. That's not the goal of marketing. The goal of marketing is to convince the customer that you are different. That's why I keep asking you, why should someone shop at your store or come to your hospital rather than go somewhere else? Well, because we've created a differentiation in their minds about why it's best for us. And we do that by positioning our product in the mind of the customer to where we want to be seen. So we want to be the full service pharmacy that takes a lot of time with you. It may take a little longer to get your prescription, but you're certainly going to leave you with more information, better understanding how to make sure the medication works, it works well, all of that. Okay, so that's sort of framing what we'll talk about today. And I really like this picture. So, getting into the pharmacy environment, let's talk about a specific pharmacy. Let's talk about Walmart for a minute. So I think most of you can associate or identify with that. You know its location, you roughly know what it's all about. Medium-sized pharmacy, they've got a lot of different things going on in there. But if you're just thinking about Andy out there, what is it that you think customers want the most when they patronize a store like this? Well, do they want speed? Everybody wants to be done fast. Nobody wants to wait. Question might be, are they willing to accept a little longer waiting in exchange for something else that's also valuable to the customer? And that might be true. And what might that extra thing be? It might be time with the pharmacist. It might be time to go get a cup of coffee next door at the sandwich shop. Whatever it might be, we've got to figure out what it is and provide that for the customer. So, what I like to ask is, what is it about Hawthorne? What is it about a community pharmacy? What is it about Walmart that makes it remarkable? Now, if I were to ask you what makes Walmart remarkable, would you come up with anything? Good. Yes. Cheap insulin. Cheap insulin. Okay, that's good. And does that attract a customer base? Does that appeal to certain people? Absolutely. Actually, that appeals to the #1 spending customer in community pharmacy history, diabetics. They spend more per capita than any single other entity spends in a pharmacy. So does it make sense to sell them something like insulin very, very cheap because they're going to be buying a lot of other things? Yes, it does. What else could be remarkable about Walmart? You know, they say location, location, location. Our Walmart's pretty much everywhere now. So its location makes it kind of remarkable. You can go into a Walmart pretty much anywhere you need to. So there's always that secure feeling, well, if I get my prescriptions filled at Walmart, if I have a problem on vacation or while I'm traveling, there'll be a Walmart nearby. So that could make them remarkable. Is there generally a long wait at Walmart? Depends on Walmart, but generally they have plenty of staff, more so than a lot of places. So they might be remarkable in that their waiting time is less. So this is just part of analyzing our internal resources, our strengths, weaknesses, opportunities, and threats that we talked about last time, which is another question I love to ask about SWOT analysis. So when you figure out what makes you remarkable, that's the starting point of your marketing. But it is a very difficult question to answer. Now, if you look down here, there's a word in here, environmental. Does this have to do with heating and cooling and ventilation systems? What am I talking about with environment? What kind of environments impact us? Well, we got the internal environment of the business. We have that. So that's the staff, the friendliness of the staff, the education level, the variety of clinical skills, all those kinds of things. So the environment is the internal, and then the external environment. Is pharmacy a competitive business area? Yeah. Are there lots of different choices? There's plenty of pharmacies out there. So the business environment, the internal and external operating environment, it's impacted by these other issues, legal. So you've got the FDA or the state board making rules. You've got social things going on. You've got ethical dilemmas. This patient's prescription is 52 MMEs, and CVS says I can't fill anything for more than 50 MMEs in a day. Should I go ahead and somehow override the system and push it through, or lie to the machine or something? So we've got ethical considerations out there. Technology, the systems. We have drugs now that are capable of things they did not used to be capable of, that require technology as their assistant. And so that's changed the shape of things. But basically, I'm looking at all of these kinds of factors. Notice I left this one off, basically because I didn't want to start a riot in the classroom, given that tomorrow is election day. But politics can also play into this. Is the Affordable Care Act one of the things that will be debated in tomorrow's election? I think you'd probably all agree that if you watched the TV any time recently that it probably will be. Okay, so we look at the analysis. What are we good at? What are we bad at? Where do we get stomped on by the competition when we try to engage the consumers in this area? And what kinds of opportunities and threats do those create? So with this sort of background, looking at Hawthorne, it's probably easy to understand why they've been there a long time. The customer base that they've attracted is a customer base that they've learned how to meet their needs, solve their problems, and ultimately make them happy over a long period of time. It's said that about 1 in 5 people moves out of a given area every year. If you take that to the extreme, every 5 years you have a complete turnover of customers. So you can't rely on word of mouth anymore, and that's important. So you've got to rely on what you're doing marketing-wise to continually be assessing what's going on out there in the marketplace. What are my strengths, weaknesses, opportunities, threats, what's going on in the environments, and how does that impact what I'm doing business-wise? Does the technological revolution not make one of the best examples of how pharmacy is going to continue to change in the future? I think so. All right, let's talk about the product a little bit too, because I've kind of downplayed it, because the bottle of pills, I think most of us would agree that a bottle of pills is the same from Kroger as it is from Walmart, is it the same from CVS as it is at Hostens. It is what's in the bottle. More than likely, pharmacies in this area are buying from the same manufacturers, unless it's a national chain that has their own distribution system, which may not. But for the most part, the bottle of pills is the bottle of pills. If you get an FDA-approved generic hydrochlorothiazide, it's the same no matter where you buy it. Agreed? Probably. But when we consider the market for a product or service, I want you to understand something, that there's this early phase where things get started, there's the maturity phase where things have grown dramatically and their product is much more popular, and then at the end, there's the end of the product life cycle, or the decline phase. When things are new, when immunizations were new, how many people got flu shots from pharmacies? Just a few. That grew over time, and we're probably here in the maturity phase now. This could last a long time, because as it turns out, it's a whole lot easier to go to your pharmacy than to go to your doctor's office. And pharmacies have learned how to do the billing now, so they don't have to charge you for it. They can just bill your insurance. And if you do need a shot, and you don't have insurance, and you have to pay cash for it, pharmacies are able to offer them at competitive prices. Will that begin to decline? What could cause? Let me just see what you can think about. Just try this for a second. What could cause a decline in flu shots at pharmacies? Can I throw one out for you? A flu shot that is once every 10 years, and you don't have to go every year and get your flu shot. So technology could change the face of what we do flu shot-wise. What else could change the face of it? How about if the healthcare system decides that pharmacists aren't providers, they shouldn't have provider status, and they shouldn't be delivering shots in the community? Could a law come into effect that would rip that right out from under the feet of pharmacists? Wouldn't be very popular with us, but it might be really popular with whoever replaces us. So there are plenty of examples of how markets change and things begin to decline. When you think about pharmacy delivery services or charge accounts at pharmacies, they're pretty much non-existent now, with few exceptions. So that product or service has begun to decline because of changes in the environment. Oh yeah, I forgot to make the kinetics. This is total sales. You all remember kinetics? For those of you who passed kinetics, I guess. The area under the curve. All right, never mind. Enough of that. Just one more comment about competition. This is a graphic over here. This is Piedmont Athens Regional, your practice, a couple of competitors here. Maybe this is Walmart, or this is Walmart, and this is CVS. One of the things that we don't even realize it's happening, but it happens, is that people think about us in a certain way. This is called product perceptions. So when you think of Walmart, you think of something. I don't know what it is, but you think of something. When you think of CVS, I don't know what it is, but you think of something. Probably something less than Walmart. But when you think about any retailer, you are probably positioning it somewhere. We can quantify this from a marketer's perspective in terms of any variables. This might be friendliness of pharmacists, and this might be some other variable. But price and performance is an easy comparison to make because most people can understand and are aware of pricing and performance. So performance is, let's say, how happy you are with your prescription experience, and price is how much it costs you. If you're a cash paying customer, you might see something like this. If you're an insurance customer, what happens to the issue of price? It becomes one flat line, and then everything that matters is about performance. So when price doesn't matter anymore, what does matter? How well you're meeting customer needs, solving their problems, and making them happy. So anyway, depending on what you're measuring, what anchors you're using on this graphic, it can provide information about how you measure up to the competition. And what that does, it's really straightforward. What that does is it gives you information about what you might need to do to fix the problem. So if we were looking at cash paying customers and price, we could look at this and say, this is really where we are in customers' minds. We have higher prices than D, but we do a little bit better job of meeting their needs and making them happy. We have lower prices than Piedmont, but do a lot better job of making them happy. And the lowest price pharmacy out there doesn't do hardly any good at all in terms of making their customers happy, but they have low prices. So for the customers that are mainly concerned with price, where are they going to shop? At C. The customers that are mainly concerned with how well you do at solving their problems and making them happy, they're going to shop with you. Okay, that's all there is to that. How do we measure? Any ideas how we measure these perceptions? Surveys, focus groups, phone calls, anecdotally collected data, lots of ways to get it. It can just be common sense that tells you, well, we do have higher prices, but we do a much better job. So it's an analytic tool that just helps you decide what you need to do in your marketing. But bottom line, it's all about customer satisfaction. And that's the missing word in the true-false question that I asked you earlier. Needs, wants, and demands. So you need food, you want a cheeseburger, you demand a Burger King. If it's on the $2 menu, it provides good value, and if you eat it and you like the way it tastes, and it was made properly, and it wasn't cold, and it was fully cooked, then that provided satisfaction and made you happy. Needs, wants, demand, value, and satisfaction. And that's what your customers, that's the process they're going through every time they enter a store, whether it's a pharmacy or otherwise. But there's lots of things that go into making customers happy. And so if you forget about that last part, it says, solve people's problems and making them happy. Just remember this graphic, that when we're talking in class about making customers happy, there was a smiley face, so that's how you remember that. So there's lots that goes into it. Individual characteristics. Question. Are there just some people that you can't make happy? No matter what. Yeah, I was reading some reviews on, online, like Yelp reviews or TripAdvisor kind of thing. And you see all these wonderful, wonderful reviews, and then somebody comments, this is like on an overnight stay, kind of like a Airbnb kind of thing, I guess. And one person says, I didn't like the color of the walls in the bedroom. So, there's just some people that you cannot make happy. There are some reasons for that. Sometimes people are sick. Sometimes they don't feel good, and it's really tough to do that. But some people are more like price issues. They're more concerned about price. They make it to the donut hole every year, but they never make it out, and they don't have a supplemental insurance that pays for that. So price becomes very important to them. Some people really want to spend time with a pharmacist, and they want to know that you're taking good care of them, that you're one of those pharmacists that does believe the pharmacy practice model is important and is going to be something you're going to pay a lot of attention to. Product quality. Have you ever opened a bottle of pills in the pharmacy, and when you start to count them, there's all kinds of powder coming out and broken tablets? There's an indication of quality. You don't sell the powder or the broken tablets to your patients, so they never see that. But that's a clue to you. What clues do the patients key in on? When the label's put on crooked, or there's an auxiliary label that's taped over some important piece of information on the label, yeah, those are things they do. When the bottle looks dirty, or the cap is stained in some way, or you spilled your coffee on the prescription label before you stuck it on the bottle. I've heard it said that if the seats are dirty on an airplane, the engines aren't properly maintained. It's the same way in pharmacy. Everything has to be just right, or else customers perceive something to be different than it is. And then other situational factors. You might have a patient that is super easygoing and great patient that they've been a loyal customer for years, and they call you on Thanksgiving Day and need you to come down to the store, and you say, I can't be there right now, but I'll be there in an hour, and they get mad. So again, the situational factors, you never know. There can be, but what's important here is looking and understanding, knowing what it is that your patients want, what they need, and trying to manipulate the variables in the marketing equation so that you meet those needs and make them happy. All right, this is pretty straightforward stuff. The product, what exactly is our product? And I think we've established it's the bottle of pills, but it's more than that. It's also the service. And when we talk about how we measure product success for just prescriptions, it's almost always in pharmacy done. We talked about the other day, what's your prescription count? That's our gauge of success. How many scripts you fill in every day? If you're getting ready to buy a new store, what's going to be the first question you want to ask? What's your script count? So is that the right question? I don't know. It's definitely important. So we know what we want to do and what our product is. Now, how are we going to figure out who to sell it to? So this whole target market analysis that we're going to talk about, which I think is one of the more, interesting parts of marketing, is figuring out who your customer is and what they need. And then this is the trick. You got a product, you know what people need. What do these people have in common? So that I can now not just have to market to each individual one of you, but to market to chunks of you, so that my advertising appeals to lots of people, not just one or two. The opposite of that, you may have heard this term. You ever hear the term niche marketing? Niche marketing is the exact opposite. It's figuring out what that customer over there needs and then doing a great job of meeting that customer's need. Then you look around and say, oh, who else does this apply to? So we're kind of looking at it from the other end of the spectrum. What can I mass market? What can I do to appeal to a large enough group of people that makes it worth my while to do that? And here's how we do that. We look at markets, segments, and target markets. So the market is prescription drugs, or the market might be everybody who needs pharmacy care. Within that, we can break it down by things like demographics, or lifestyle, or something we call psychographics. Psychographics are kind of a psychological demographic. It's how much do you like the outdoors? How much do you like to get information before you make a decision? How much do you worry about things? So your psychological makeup, are you a go-getter type A personality? Or are you more laid back? Their life's just going to come at me and I'll take it as it comes. So those are basic differences in the way people interact with the world. All of these are important. Segments can be built on all or some or multiple levels of these. What the target market is, though, and this is where the real gist of marketing takes place. Who is it you're trying to appeal to? So you might, let's just say, we talk about insulin at Walmart. If one of our target markets, you can have multiple target markets, but if one of our target markets is diabetic patients, do diabetic patients have more in common with each other than they do with, let's say, patients with multiple sclerosis? So what we quickly begin to learn then is that once we've identified who our target is, there are things about that target that we can understand and know that will help us to reach them better, and that may be different than reaching other groups. Let's look at how we do that. So we look at these 5 things. I've loved asking the question in the past, which one of these 5, if you were pushed, which one is the least important? Which one could you do without? And hopefully by the time we're done talking about these, you'll be able to answer that for me. But first, homogeneous. So we just talked about that. How much do these customers have in common? Do diabetics are they all 80 years old? No. Are they all younger? No. So it's not age. What might they all have? Well, they all have a specific group of needs. It's revolving around blood sugar management, perhaps dietary supplements, insulin, needles, monitoring devices. So they have all these needs. So it's not going to work to look at diabetics and say, well, they're all the same. All diabetics are the same age, the same race, the same gender. That kind of analysis doesn't work. But they have similar needs in terms of products. What we do like is for our groups, whatever our target market is or our potential target market, because we're going to use these criteria to establish whether it's a good target market or not. The more they have in common need-wise, wants-wise, and demand-wise, the better they are as a target market. Why? Because it's easier to reach them with more of a mass appeal rather than trying to reach each one individually. So homogeneous, we like our customers to have similar needs. That's a good thing. Accessibility, can you reach them with advertising? How many of you live in a rural Georgia area that doesn't have like a local radio station or a newspaper, right? Yeah, so how does a pharmacy reach out to you and advertise in a community like that? Well, direct mail might be an option. It might not. But certainly you're going to have limitations on how you reach your customers. In communities like that, pharmacies with great reputations tend to rely on word of mouth and that kind of thing. Community-based activities where they can spread the word about what it is they do, if they do any advertising at all. It may be that they're the only game in town and that's where people go because that's the only pharmacy available. But accessibility is important. If you're in the Atlanta area, do you have a bigger or more choices of how you can reach your customers than if you're in Moultrie? Yeah, sure. So I want to save this next one for last. But the next one is measurable. And basically, can you go out and learn about your market? Can you figure out what it is that diabetic patients need? If the answer to that is yes, and it can be quantified, diabetics are going to need, on average, X number of scripts per year, X number of vials of insulin per year, X number of glucose tablets, or whatever else they might be using, alcohol swabs, blood pressure devices, blood glucose monitors, whatever. So if we can measure them and that information is good and accurate, then that's a characteristic of a good target market. And then substantial. This is the entrepreneurial part of it. Is it big enough to justify your being in that market? You're going to spend money on advertising. You want to make it back on sales. So if it's not a big enough market, so you can probably think of several diseases, orphan diseases, that while it's important to provide care to those patients, you're not going to want to spend a lot of time and money advertising in that area because it's just not going to generate the return that you need. Anybody want to venture a guess why I said durable? I saved it for last and why it may be my least important of the 5 characteristics. Anybody at all think about that? What does durability mean? It means that it's going to be a profitable market for years to come. How about this? If you do all this marketing stuff and you're good at it, you're going to have your finger on the pulse of things that are changing. And when a market begins to decline, you're going to know that. You're already going to have planned and have waiting in the wings the next best, greatest thing that you're going to offer to your patients. So durability becomes less important. In other words, strike while the iron is hot. Make the money you want to make and provide the care to the patients you want while that is in vogue. And don't be worried about what's coming next, because you're going to be planning for that. You're going to be creating products and services that are waiting in the wings to bring out and introduce, so that you will never be without a leading product, a leading service, or something that will make you a good business. So if I had to throw one out the door, I would throw durable out, because as a good marketer, as a savvy marketer, you're going to be figuring out, you're going to know well before it dies, well before that product becomes obsolete or less profitable, and have something ready to replace it. Make sense? Okay. All right, let's talk about this for a minute. You work for Village Pharmacy in Athens. You've been doing immunizations successfully for a long time, making a bunch of money. Recently, CVS, Walgreens, and Walmart have required all pharmacists to be immunization certified and provide immunizations in the store. CVS, for example, national advertising to generate, has pulled customers from your business. This year, you had almost 300 doses of flu vaccine left over. Can you compete with CVS for immunization business, and how? Question to sort of think about along with this is, are you competing for the same customers as those who shop at CVS? Well, there's certainly some evidence that suggests that you are, if this year you had 300 doses of flu shots left over. Why? Because some of those customers probably got them somewhere else. Now, we don't know if it was CVS or a doctor's office or the health department or what, but it's possible. So what would you be wanting to know? What would you be wanting to do? Bottom line, do you think you compete with CVS or not? Well, it's going to be subject to individual thinking. But most independents have said for a long time that they're happy to compete with the big box chains, because the independents are more nimble. They can change and adjust and adapt to things much more quickly than a CVS can. They don't have to jump through all the legal hoops and pharmacist training and so forth that the chains have. So you can respond to changes in the environment much quicker. So to that point, yeah, you can compete with CVS. What about their advertising budget? Can you compete on that? Yeah, probably not. So you look at it and you go down the list and you try to think, do I do a better job? Do I have better prices? Am I more convenient? You go through the entire list of things that are important to your customers, because when you meet those criteria, you make them happy and solve their problems. And you look at that and you say, you know what, I can compete with CVS. Until you get down to the very last one, and that's how much money they spend on advertising. And then you really can't compete. In a local area with limited resources, it's very tough to compete with a national chain. So what we need to do, though, would be to develop a marketing plan, analyze the situation. We want to look at our strengths, weaknesses, opportunities, and threats, and see by our resources, why is it that we lost 300 flu shots to the chains or someone else last year? What happened? So plenty of answers to that question. It could be that we had a really crummy pharmacist that gave terrible shots and hurt, and all the people that got one and it hurt didn't come back this year for a shot. Had nothing to do with CVS marketing or our services, other than the fact that it was not a skilled immunizer. Possible? Yeah. So that's why you've got to look at the marketing side of it and say, why did this happen? What was the rationale? What's the reason? Okay, so we go through all this and we develop a market. Let's say that it was that we lost business to CVS. Then we've got to really critically analyze it and see if we're going to do some advertising, who do we want to target in our advertising? So we look at homogeneous, accessible, measurable, and substantial. And hopefully the durable kind of fades into the background. And the answers to those questions provide us with what we need to know about how we're going to reach out and target the people that we want. Who's a candidate for immunizations? Is there any demographic that stands above all the rest? People with weakened immune systems? People who are older? So we wanted to really target certain customer groups with our advertising. Those would be clues. Is there a different way to reach older people than younger people? Younger people like more digital, older people like more print. So that would impact our decisions. So once we have goals and targets to target markets, what do we do next? That's where the 4 Ps and the 4 Is come into play. And we've talked about the 4 Ps, we'll talk a little bit more about them today. And the 4 Is, also going to talk a little bit more about them. Price. Well, price is the same everywhere you go. How do we manipulate the price variable now? Well, sometimes it's by things. Walmart tried the $4 prescription. Did that take hold? Yeah, pretty much. That they revolutionized. They were a disruptor in the pharmacy pricing environment. So things like that. Credit cards. Not everybody used to take credit cards. Imagine that. But there are lots of ways that we can impact the price variable. Place, location, merchandising, people. When you look at the place variable, convenience wins hands down every time. Have you ever gone by a business because you knew you couldn't turn left and get back to where you needed to go and go somewhere else? Or gone down the road and made your left-hand turn and come back up the road to a business that's on the right side of the road so that when you turn out, you can go in the direction of traffic flow? Yeah. Or it's on the way to work, on the way to school, on the way to church, on the way home, whatever it might be. Place is paramount. Place, and place are the 3 most important variables. Can place give you a competitive advantage? Yes, it can. What about this? Do you avoid a pharmacy downtown because there's no parking? Of course. Place becomes critical. Now, if you live in one of the high-rises downtown, do you avoid places you have to drive to because then you have to get your car and go drive to it? So, depending on who you're targeting, place matters. What about the product? Anybody recognize this? It used to be Target's bottle. Now that Target's gotten bought out, I haven't checked to see if they're still using those or not. My guess is no. Anybody work at Target? Do they still use those? Did you ever work when they did? They complain they don't have them anymore, or they complain that they still get them? Okay, so patients complain that they didn't have this bottle. And that's good. That means that Target figured out something that made people happy. And it's stuck. So that's really good. So it was a way of differentiating the product from the other bottled pills. I thought it was a brilliant idea. I'm not surprised that CVS didn't stick with it because CVS likes to have its footprint as well. And this wasn't on their list of things that was important. What about promotion? Lots of different things go on in terms of promotion, but bottom line, what's my recommendation? And this guy can put a multiple choice or true false about this. If you're getting ready to do promotion, what does Dr. Perry recommend? Hire somebody with creative talent to do your promotion for you. Yes, that's what I recommend. But you don't have to. You can work with local, but at least work with local ad people that do this for a living and understand how to create good promotions. I have seen some of the worst commercials in my life, and I'm sure you have too. Just why in the world would they put a commercial like that on TV? And then service marketing, we talked about this a little bit. The main thing here with service marketing, if you look at patient counseling, by example, on the bottle of pills at 2 ends of the spectrum, they're very different concepts. And they really can't be separated. So while they exist on the tangibility scale, part of it is very intangible, part of it is not tangible. And that doesn't mean that on average they're medium tangibility. What it means is that for certain aspects, for certain customers, that bottle of pills is going to be important. For other customers, it's going to be about the patient counseling. For everyone, both will be important. The argument has been made that we don't have a fixed inventory of services. We talked about this last time, but it could be. It could be that that's true. If you get burned out, you get tired. It's just how it works. And then individualized. You have a good day, you have a bad day. You have a good morning and a bad afternoon, or vice versa. These can impact the way you interact with the customer and what they perceive as part of their care on that given day. All right? And this won't be on the test because marketing strategies we just don't have time for. The last few slides, I'll let you just review those on your own, but they talk about different kinds of promotion. My advice is hire somebody, but think about it. There's a lot of these things you could do yourself. Facebook presence, Twitter, other social media presence in your community, marketing to doctors, other pharmacies and clinics about services that you may offer that are unique. Lots of things you can do that will help you. Remember, social media can be used for you and against you. So if you're getting reviewed by somebody that wasn't happy, that has a lot more reach than if they're just complaining to their neighbor. So if you're going to get involved in this, hire the right people to help you understand it so you don't get hurt by the media. All right? And focusing on marketing decision making, I think this we talked about as well, just to bring it back home. When you're selling a bottle of Geritol, or when you're refilling somebody's hydrochlorothiazide for the third time, there are different things that are going to be important to those customers. The bottom line is you've got to recognize that and be able to solve both customers' problems, keep them happy, and keep them coming back. So marketing is both individualized and it's a mass appeal. So the bottom line question, I'll leave this for you to think about, and it's really all we have to say about marketing, is how do you manipulate the 4 Ps and the 4 Is to do what? So that your business stands out in customers' minds, and so that you solve their problems and you make them happy. And that's the end of the story. Any questions? Okay, we get to switch gears, and on Friday we will talk about motivation. What a great segment. All right, I'll see you all Friday. Good night.